Doctors hold an important place in American life. When we are born, when we get sick or hurt, and as we age, doctors provide care and comfort. In fact, most Americans believe the best health care in the world is found in the United States. But America faces a challenge. Our current training system is designed to produce medical subspecialists, doctors with a narrow focus of expertise. What America needs more of is doctors who specialize in the whole person. What America needs is primary care doctors. Family physicians are primary care doctors. They provide us with a medical home and help us when we meet other specialists. But the number of doctors in primary care is not keeping up with our growing and aging population.
Already, many Americans cannot find a primary care doctor, and many rural communities are without doctors. The lack of primary care physicians is contributing to poor health outcomes.
Compared to other developed countries, healthcare outcomes in the U.S. are worse, yet expenses are higher. A major reason is we have an imbalance of subspecialists versus primary care doctors.
The imbalance is, in part, due to the way we pay for graduate medical education, often called GME. The majority of our GME funding comes from the federal government through Medicare.
Our GME system is designed to produce subspecialists. This is creating a mismatch between the health needs of the population and the specialty makeup of the physician workforce.
Young physicians are interested in primary care. There are tremendous rewards being a family physician.
I chose the primary care specialty of family medicine because I want to have a relationship with my patients. And this is a wonderful way to serve my patients, but there's not a lot of support for this area of medicine.
If we don't do something to increase the number of doctors going into primary care, we will continue to have people who can't find a doctor and poorer health outcomes.
We do not have enough doctors going into primary care to replace the number of physicians who are facing retirement. The numbers are trending in the wrong direction.
America's population continues growing and our nation is aging. We need primary care doctors.
People do better with a medical home, and family medicine is one of the primary care specialists that offer a medical home.
So where are those doctors going to come from?
When a doctor graduates from medical school, the next step in completing their training is a residency. As a residency director, my job is to support these young doctors as they do their residency training with experienced physicians.
You may be surprised that the federal government subsidizes residency training. Hospitals receive federal funds for each resident that they train, but the funding is inconsistent. It changes from hospital to hospital, region to region. It can vary as much as $220,000 per resident per year for one hospital and as low as $48,000 per resident per year for another. GME needs to offer secure and predictable funding.
It's important to note that the number of residents continues to expand every year, but the problem is that the majority of those residents go into specialty care, not primary care. One reason is that the GME system doesn't require a certain number of residents in each specialty. Another is that primary care doesn't produce as much revenue for the hospital as subspecialty residents. And residency training is paid for by both Medicare funding and revenues from the patient care at the hospital. Hospitals are interested in increased clinical revenue that subspecialties can offer. This imbalance is worth addressing because we don't necessarily need more doctors, but we need more doctors that practice primary care rather than subspecialty medicine.
We need an accurate way to count who goes into primary care. Right now, we count the medical students that go into primary care residencies. The problem is, within 5 years, a majority of these doctors are no longer in primary care. It makes our early accounting misleading.
Leaders on this issue met in Washington, D.C. in June of 2014 to present this information to policymakers.
We discussed 3 actions that can address the heart of this issue: setting a goal for the number of primary care doctors needed, measuring primary care training accurately, and we can direct the funding to programs and settings that train primary care doctors.
The summit was an important step in discussing the changes that need to be implemented. The right mix of people were involved in the conversation, and there's support from all sides for a thoughtful and long-term solution.
Meetings like the GME Summit have gotten the conversation started, and the Institute of Medicine recommendations are a good place to start taking action. But now we need to engage Congress and congressional staff to effect the needed changes.
I'm optimistic.
People are talking about this.
This was requested by 7 bipartisan U.S. senators.
When we went to Washington, people were very receptive.
We hosted a meeting for 75 people and 130 showed up. The room was packed.
Change doesn't come overnight, but we're on track to fix this.
If you work in the legislature, we would love to work with you. Together, we can design effective legislation that will benefit the people in your state as well as the entire country.
People are healthier and costs are lower when there are more primary care physicians in a community.
If you're a patient, a doctor, or someone interested in getting involved, please go to our website.
This is a national conversation about improving healthcare in America by helping to establish a strong primary care foundation. Let's set a more realistic goal for the number of primary care doctors, measure the production of primary care accurately, and provide funding directly to the programs that produce primary care physicians.
We look forward to hearing from you.